change in diet and lifestyle will actually prevent all of these diseases. I have a previous video called You Can't Improve on God, where I interview my 85-year-old mother. She had a severe autoimmune disease called polymyalgia rheumatica, and I put her on the same plan that I used to get well from cancer. And she was able to get off all 4 high blood pressure medications she had been on for as long as 35 years. She got off of them in 3 weeks by following this plan of a major change in diet and lifestyle, getting the fat out, getting the excess protein out, getting the sugar out of her body, drinking lots of water, eating good food with a lot of raw food, getting plenty of rest, some exercise, fresh air, and sunshine. These things all seem too simple. Doctors say we need drugs, but drugs don't cure disease. In fact, all drugs have side effects. If we look in the physician's desk reference, which is a huge book, it's this big, and it's very fine print, and it has the all of the side effects of the drugs are in this huge book. It's put out by the pharmaceutical companies. You will find that there's not one single drug in that entire book that does not have side effects. Some of them are so serious that they cause death. Now, why would you want to die from a drug you're taking, which is probably a far worse side effect than the disease can cause in your body? So you see that cardiac disease is not caused by a deficiency of bypass surgery. It's caused by too much fat and cholesterol is found in animal products. Cholesterol is not found in vegetable products. You don't get cholesterol in broccoli and cauliflower and celery. You only get it by eating animal products. Cardiac disease is caused by too much protein. That's in meat, poultry, fish, dairy products, and eggs, because this excess protein is stored as fat. It increases the level of your triglycerides, which is a measure of the fat in your blood. Smoking also causes cardiac disease. In fact, one cigarette causes a rise of 10 to 15 points in your blood pressure. It increases the work for the heart, and it increases the carbon monoxide in the body and decreases the ratio of carbon monoxide to oxygen. We need a lot of oxygen in our body, and we need to get rid of the carbon monoxide. Sugar is stored as fat and has the same problems. Aspartame, which is NutraSweet, causes abnormal heart rhythm, shortness of breath, chest pain, and high blood pressure. Caffeine can cause arrhythmias or irregular heart rate. Lack of exercise, of course, contributes to heart disease because you don't work off the fat. You don't get the oxygen going around to your muscles, including the muscle of your heart. Fluoride causes calcification of arteries, and dehydration causes thicker blood. And then when you don't eat enough nutrition, enough good raw, fresh fruits and vegetables, you don't get enough antioxidants into your body, which help go around your body and destroy the toxins and destroy the waste materials that are produced by the everyday reactions in your body. So again, it's not a mystery. You can get rid of your heart disease. You don't have to undergo coronary artery bypass. There is a shorter-term solution, which is not the ultimate, but there is a treatment called chelation, which is the use of EDTA, which is it is a chemical, and it is not the final answer, but this is used by many doctors, MDs, and doctors of osteopathy, where they can put a solution into your to you intravenously through an IV, and it will help decrease the amount of plaque in your arteries. Now again, this is not a long-term solution. It is a short-term solution, but it can give you some buying time if you are close to having a coronary artery bypass. Now this procedure has been ridiculed by a lot of doctors who don't understand how it works. In fact, this EDTA we have used for patients many times who have heavy metal poisoning. We've given it to them in the emergency room. But this is being given on a chronic basis. You go and you have one IV treatment after another until you slowly decrease the amount of plaque in the arteries, and that will be a short-term solution, but the only way you can really have a long-term solution is to change the way you eat and change the way you live. Now, it's not just your diet, and it's not just drinking water, and it's not just eliminating all the bad things that you shouldn't eat. It is also getting hold of the stress in your life and getting it out of your life. Stress alone is one of the major causes of death in America. And if you are holding grudges, or if you have anger, or if you are under tremendous stress at your work or in your home or whatever you're doing, this all causes an increase in the fat content of the blood. It causes constriction of the arteries, and it helps increase your possibility of heart disease. You really can't get well from heart disease unless you change your lifestyle. You can have one bypass after another, but it's not going to do the job. Only if you change your diet and lifestyle can you actually get well. There are lots of different types of cancer. At least we in the medical profession break them down into various grades and various types. Cancer includes Hodgkin's disease and leukemia, which is nothing more than cancer of the blood, just of a different organ. Multiple myeloma affects the bones and other tissues throughout the body. Malignant melanoma is a cancer that appears to start in the skin, but really can be a disease that can kill you. It's different from regular skin cancer. And then, of course, we have cancer of the brain and breast and prostate, stomach, colon, liver, pancreas, many different organs, and even AIDS is a form of cancer. However, cancer is cancer. We have all these different designations, but all cancer is caused by suppression of the immune system. Cancer is really a deficiency disease. You know, years ago, back in the 1500s, when sailors went out on ships during the Crusades and other endeavors, many of them died. In fact, they thought a terrible disease was sweeping the country, and they were giving them the drugs that they had at that time. But these sailors died in large numbers. Finally, someone decided to put limes on the ship, and the sailors ate the limes because they were really suffering from a deficiency disease, which was a vitamin C deficiency, scurvy. When the sailors ate the limes, they did not die. They remained healthy. And that's why English sailors got the name limeys. Well, it took about 200 years or 250 years for the rest of the medical profession to pick up on this and realize that this was nothing more than a deficiency disease. Well, by the very same token, cancer is a deficiency disease. Cancer is caused by the same three things we talked about before. It's caused by malnutrition because you're not getting enough good nutrition into your body, and you're getting an excess of bad nutrition. It's caused by dehydration because the body runs on water. We're not getting enough water into our body, and then stress. So if you put these three things together, I think you will see as we talk today that these are the real main causes not only of cancer, but of all disease. I became very interested in cancer myself because I developed cancer. Cancer is probably the most dreaded disease known to man, and in fact, it's probably the most dreaded word in the English language. I developed severe advanced cancer. First, I developed a lump that was small. I had it biopsied, and it was ductal adenocarcinoma, the invasive type, carcinoma of the breast.